Welcome back. So in this video, we'll be discussing a common symptom that a lot of veterans want to claim. We also will discuss that symptom's actual diagnosis as well as implications. And so urinary frequency, we'll discuss what urinary frequency is, of course, how it happens, and more importantly, how to get it rated and what the actual diagnosis is. And so today I have with us Dr. Nguyen. She serves as our big doctor here in the firm, making sure all our veterans are taken care of. She's the brains behind the diagnosis as well as putting DBQs together for a lot of our clients. And today we're discussing urinary frequency. So tell me more about it. How does it happen? And what is the actual diagnosis for this?
Yeah, so also called neurogenic bladder. This is just a name given to actually a number of urinary conditions in which people who lack bladder control due to a brain, spinal cord, or nerve issue. You do have to think that muscles and nerves have to work together at the same time in order to hold and release urine at the same time and at the right time. So if you have any issues in that, then this is the condition that you experience due to that issue with your nerves and your bladder control. So nerves carry messages between the bladder and the spinal cord and the brain. So any interference in between this messaging will result in abnormalities. Some causes of bladder issues are spinal cord injuries or diseases that affect the nervous system. These actually include things like diabetes, which is extremely common, infections as well. There are genetic nerve issues, heavy metal poisoning, which could be during like military exposure, birth defects that affect the spinal cord tumors, stroke, multiple sclerosis, spinal surgeries like back surgeries as well could cause injury to the nerves in that area. Erectile dysfunction itself could also even cause bladder issues. And then trauma, accidents to the nerves around the bladder area. Some symptoms of bladder issues are painful urination that you can see during UTIs. You can have kidney stones. You have incontinence where you're not able to urinate when you want to or try to, or a really small amount of urine comes out. Leakage, dribbling of urine. Cannot feel when the bladder is actually full. Or that when you're releasing urine. So these things can tremendously affect your life.
So you made some really good points about some of the symptoms and other diagnoses that can cause this issue. Two stuck out to me: diabetes mellitus type 2, as well as erectile dysfunction. And so essentially these two conditions, either independently or combined, could cause neurogenic bladder.
Yes, just imagine anything that can cause damage to your nerves. So with diabetes, excessive blood sugar can cause damage to the kidneys, the vessels, nerves themselves. So it's just kind of like destroying those nerves and vessels.
Wow. So for you veterans out there that are listening, this is a huge opportunity in some cases for a lot of veterans to get things service connected. Here in the firm, we hear a lot of veterans that ask us about, I'm using absorbent pads, I'm finding myself urinating every 10 or 15 minutes. When I drink any amount of water, whether it's large or small, I'm finding myself constantly going to the restroom. And so the first thing we try to do is find a way to, one, get this service connected. And the actual diagnosis is neurogenic bladder. And so for you veterans out there that are claiming urinary frequency and getting your case denied, it's a high likelihood that you're not claiming it the correct way, which of course is neurogenic bladder. Now, of course, as you are asking for this service connection, you have to have some way to prove it, either from military service or more importantly from other conditions as expressed here, diabetes mellitus, and of course, erectile dysfunction. And so how does it rate? Top end urinary frequency rates at 40%. And so let's switch to my screen here. So how does it rate? Top end urinary frequency rates at 40%. And 40% is daytime voiding intervals of less than 1 hour or awakening 5 or more times per night to urinate. At the 20% level, you're looking at daytime voiding intervals between 1 and 2 hours or awakening 3 to 4 times at night to urinate. At the low end of 10%, you're looking at intervals between 2 and 3 hours per day, as well as 2 or 3 times per night of urinary frequency. Now, as expressed before, Dr. Nguyen made a very good impression about the ways this can also be combined, from urinary frequency to obstructive voiding to also urinary tract infections as well. All of these different conditions, as you can see on my screen here, are what the VA rates. So in closing, If you are having a condition where you're constantly urinating, or you're finding yourself not being able to hold your bladder, or anything with that particular issue, give us a call. If you have perhaps radicular issues with your back as well as with the nerves combined, that can be a really big indicator that those two things, as well as other things possibly, that are causing urinary frequency. So if you're having this issue, give us a call. We're more than happy to help you out and make sure that you win your VA claim. Thanks for joining us.